Good day, everyone. I'm John, your moderator for this webinar on the behalf of the Randizer company called Conference Panel. I welcome everyone for today's webinar, which is called 2023 ICD-10 Coding Update and Home Health Hospice. So now I would like to introduce our presenter for today. She is my all-time favorite speaker from Home Health and Hospice. Her name is Sharon Litwin. Sharon Litwin is certified experienced ICD-10 coder. She has extensive experience in teaching home health and hospice topics, and is a regular speaker for education companies and state and national associations. So now I would like to hand over the floor back to our speaker. Over to you, Sharon.
Thank you so much. Hi, everybody, and welcome today. We're going to go over the very numerous code revisions for our 2023 ICD-10. If you don't know about these, well, they started October 1st. And, we've had quite a lot going on, and a lot of people are just learning them now. There's 1,176 new codes, but the big portion that will take a lot of this class is the changes to dementia. We do in circulatory, the I codes, have an addition of 43 new codes. The external causes an awful lot of electric bike injuries. So these are the chapters. So the coding guidelines, another coding guideline, the documentation of complications of care. Chapter 1, certain infectious and parasitic diseases, A00 to B99. If a patient is admitted for HIV-related condition, the principal diagnosis should be B20. So for B37.3, candidiasis of vulva and vagina. Chapter 2, neoplasms, C00 to D49. Okay, the chapter guidelines here, a secondary malignant neoplasm of lymphoid tissue. Chapter 3, disease of the blood and blood-forming organs and certain disorders involving the immune mechanism. D50 to D89. So they expanded the subcategory for D59.3. That's the types of HUS, hemolytic uremia syndrome. Now they expanded greatly the subcategory D68.0, von Willebrand's disease. They expanded the subcategory D7582, HIT, heparin-induced thrombocytopenia. They changed D75.89 to D75.84, other platelet activating anti-PF4 disorders. D81.8, other combined immunodeficiencies. Chapter 4, endocrine, nutritional, and metabolic diseases, E chapter. So guidelines for the injectable non-insulin drugs. Expanded the subcategory for E34.3, short stature due to endocrine disorder. They expanded the subcategory E87.2, acidosis. Chapter 5, mental, behavioral, and neurodevelopmental disorders, F01 to F99. So the existing dementia codes don't fully identify BPSD, behavioral and psychological symptoms of dementia. So the definitions in the coding guidelines: vascular dementia unspecified severity, F01.518, vascular dementia unspecified severity with other behavioral disturbance. Now we get to F01.53, vascular dementia unspecified severity with mood disturbance. So you can see how many codes were added. So now here's an example of moderate. Okay, and then C. So you can guess that, A, B, and C, mild, moderate, severe. Now, FO2 is dementia in diseases classified elsewhere. And then FO2A is dementia in diseases classified elsewhere. Mild, B is moderate, C is severe. Expanded the code FO6, other mental disorder, physiological condition. So mental and behavioral disorders due to psychoactive substance use, and those are F10 to F19. For the mood affective disorders, F43, they expanded the category reaction to severe stress and adjustment disorders. So Chapter 6, diseases of the nervous system, G00 to G99, inflammatory diseases of the central nervous system, fall in G00 to G09. So G10, Huntington's code. Okay, G31.0, frontotemporal dementia. We have a lot of the little term differences. G71.0, muscular dystrophy. They expanded that category. Limb girdle, muscular dystrophy. G90, disorders of autonomic nervous system. G93, other disorders of the brain. Ischemic heart diseases, I20 to 25. These are all the type with the graphs, with angina. Other forms of heart disease, I30 to I5A. I34.0, non-rheumatic mitral valve insufficiency. I47 for paroxysmal tachycardia. Diseases of arterial arteries and capillaries, I70 to I79. And then they expanded the category I71, dissection of the aorta. They added I77.82, ANCA. Chapter 10, respiratory system, J00 to J99. J96 is respiratory failure. Chapter 11, diseases of the digestive system, K00 to K95. Diseases of the liver, K70 to K77. Chapter 12, the skin and sub-Q, the L chapter. Chapter 13, musculoskeletal and connective tissue, M00 to M99. So M51, now disorders of muscles, M60 to 63, M93, other osteochondropathies. M96.A, fractures due to compression of the chest and CPR. Chapter 14, diseases of the GU, genitourinary system, N00 to N99. So renal tubulointerstitial diseases, N10 to 16. Inflammatory diseases of the female pelvic organs, N70 to N77. 168 new endometriosis codes. And so you have N80.0 uterus. So for the ovary, for example, N80.1. So other anatomic areas, N80.B is endometriosis of cardiothoracic space. Chapter 15 is pregnancy, childbirth, and periperium, O00 to O9A. So a chapter guideline for hemorrhage post-elective abortion. There are multiple additions to O35. Expanded the categories of P28.3 and P28.4. Chapter 17, congenital malformations, deformations and chromosomal abnormalities, Q00 to Q99. So they expanded malformations of the cardiac septa regions, expanded category of Q85, phacomatosis. All right, so this is our R chapter, R00 to R99, chapter 18. Signs, symptoms, abnormal clinical and lab findings, not elsewhere classified. For R53, malaise and fatigue, chapter 19, that's the huge chapter of S00 to T88, injury, poisoning, certain other consequences of external causes. Documentation of a change in the patient's condition is not required in order to assign an underdosing code. Okay, S00 to S09 is injuries to the head. Okay, so concussion has been expanded a lot. Okay, chapter 20, this is where I couldn't find electric bike collisions in the V00 to Y99. Chapter 21, Z00 to Z99. Factors influencing health status and contact with health services. So the social determinant of health, so now they expanded category Z59.8, and then Z59.86, financial insecurity, Z59.87, material hardship. Oh, okay, so that was it of the SDOH, dramatic shift to steroids, and then chemotherapy, multiple additions of specific types. Z91.A, caregivers' noncompliance with patients' medical treatment and regimen. Z91A4, caregivers' other noncompliance with med regimen. Now this is patients' noncompliance with dietary regimen, which falls under Z9111, and medication treatment falls under Z9119. That they're very important for you to have. So I want to really thank you for being with me today.
Thank you so much for joining today's webinar. Have a great day, everyone. Thank you, Sharon. Thank you so much.
Thank you.